this is Dr. Eisenbrown. I'm here to answer some of your questions about the common urology problems that we see. I have a fair number of women who will come in describing that they have slow flow. So if you have slow flow, feeling like you have to push to get started, takes a minute or two to get started, or you don't feel like you empty your bladder, there's only one of three possibilities of what could be happening. In normal urination, you have the bladder neck, and you have the sphincter. The bladder is what stores the urine. The bladder neck and the sphincter I think of as a double-layered door. So as you and I are having this conversation right now, the bladder is relaxed, the bladder neck and the sphincter are contracted. When we go to urinate, the only part of it that we control is the urinary sphincter, and it's a relaxation. So you relax the sphincter, that sends a signal to the spinal cord telling the bladder neck to dilate into a funnel shape, and another signal goes to the bladder telling it to dilate, and then urine flows through a funnel. If that doesn't happen the way it's supposed to, with, for example, slow flow, incomplete emptying, straining, starting and stopping, any of that, the only three possibilities are that the door is not opening, the bladder's not squeezing, or something's in the way. Now in women, something in the way is not very common. In men, we think of the prostate because they have a prostate that obstructs them, but you and I don't have prostate, so it's not likely to be the prostate. The most common thing I see is the door not opening, which is called pelvic floor dysfunction. And basically what that means is that the pelvic floor muscles that are contracted all day long, specifically the sphincter and the bladder neck, go into spasm. Then you go into the bathroom to urinate, you try to tell them to relax, but they either don't or they don't do it effectively, and then your bladder is trying to squeeze against a closed door or squeeze against a straw. That also causes overactive bladder symptoms. So it not only causes slow flow, feeling of incomplete empty, and difficulty getting started, you also might find that you have overactive bladder symptoms of frequency, urgency, nocturia, or even urge urinary incontinence. So if you have both of those, we need to address pelvic floor dysfunction and your overactive bladder symptoms. Thank you for your attention, and I really hope that this has been helpful. If you have further questions, please don't hesitate to ask me when we see you in the office.